Living donor is very important because there are 17,000 people waiting on the liver transplant list, and out of which 1 in 5 either die or get removed from the wait list. And there are 6,000 deceased donor transplant each year and 250 living donor transplant. At least 25% of them either succumb to their disease or die, or they lose the opportunity to get the liver transplant at the right time. So that's why it's important to talk about living donation to the patients who are on the wait list or who get evaluated to be on the list. Living Donor Champion is a program where when we talk to the patient's family, we ask them to identify a member of the family or a friend, which could be a caregiver or not a caregiver, to serve as a role of a champion. The champion is a person within whom they identify, who takes up the role of identifying a living donor for the recipient. So this way, the recipient is not involved or burdened down in finding a living donor for himself. So the champion then utilizes multiple tools in finding the living donor for the recipient. We help him or her with the several tools, including social media, social hub, and going to local churches, creating a campaign or flyers in these with multiple tools where they can identify a donor, which is a living donor for the recipient. The living donor liver transplant team at UPMC is going to work very closely with the champion to help them access the multiple tools to identify the donor for the recipient. They have access to all our coordinators. They can call one of the physicians in the team or the surgeons. We'll help them to find the donor, the living donor for the recipient. There are a multitude of reasons for living donor liver surgery, so it's truly a life-saving operation. So it's a non-emergent surgery and it's an elective surgery. The patient who gets a living donor liver surgery are getting it when they're less sick and their MEL score is low. So their recovery time is much faster and they get out of the hospital much sooner. And the outcomes of living donor surgery is also better than the deceased donor liver transplant. And if one person gets a living donor surgery, that opens up the spot for somebody else on the deceased donor liver to move up. So that is also one of the benefits. UPMC is a very high volume center and extremely experienced. And it is one of the only living donor center in Western Pennsylvania. And we have a skilled group of transplant surgeons, transplant physicians, nurse coordinators, social work, living donor advocate, and behavioral medicine. The whole living donor team is extremely enthusiastic and passionate about what we do. And our mission is to reduce the waitlist deaths on our transplant waitlist. And we take pride in what we do.